Hey Mo,
Hey Ricky, how you doing?
good. The doctor is in.
Yes, we are. And it's so interesting that we're coming up on our birthday, our anniversary, and
We
we
are.
started this, right? Like to try to bring services to people where they are, to try to reach breasties and talk about the issues they were facing, to try to get them to join clinical trials,
Yeah,
go to chemo, get your mammograms, all the things, right? Through this
all the
virtual
things.
platform because of COVID. We couldn't gather, couldn't meet. And
Right.
so, how fitting is it that today we're talking about telemedicine and telehealth, right?
Technology.
It's
Yeah,
a full circle moment.
it is. And we have two men on our show. You guys, you have no idea. It's a very special thing to be a man on our show. Okay. We're very female focused, breast cancer, but we're so glad you're here and we're so glad to talk about this. And kind of when I teed this up in my brain, I was thinking, I don't want to drive a Model T. It would be really cool to have one, but I like my little car. My electric car. I don't want to trade my iPhone 14 in for a rotary phone, even though I do have one that was my grandmother's on a desk, right? I don't want to give up technology. But so we're living in this world where we're surrounded by technological advances every day. I mean, it's almost like you have to buy a new iPhone every year, for God's sakes. I hate that. But I want the best computer. I want the best technology to help me do things in my world. So why wouldn't we apply that to science and health? And I think that we are, and we're trying to, but how do we make it more accessible, more user friendly, a better place to be? So we want to hear you guys talk about what you're doing. And I think it's really cool, and like bring this to our audience and talk about it. So who are you? Augustine, who are you?
Yeah, my name is Augustine Cowan, and I tell you, this is a full circle moment for me as well, Ricky and Dr. Gary. Just thank you for this opportunity. And you talk about your anniversary, and this is kind of like the 27th anniversary that I lost my grandmother. And I lost my grandmother to breast cancer. And I saw
Sorry
and
about that.
heard my grandmother suffer due to the pain of breast cancer. And at the time, I was, 20, 23 or something like that. And I just had no idea the what options were to her. And so, God bless you, Ricky, and thank you for starting the Black Breast Cancer Alliance, because my grandmother didn't know. She didn't know that, what questions to ask. She didn't know what to do. She waited to the last minute. And one of my very last conversations with her was her just pleading to God to take the pain away. And I still hear it till this day. My sweet grandmother, Mamie Nell Moore, talk about suffering in her room by herself with breast cancer. And so for me to have the opportunity to speak to you, your breasties, and to be on this call is very awesome. My mom is a breast cancer survivor as well, 20 plus years, and she's still thriving and doing great things. But so it is truly an honor to be here to speak with your team and share care clicks and share virtual medicine and how it really can bring access to care, especially to your core group of African-American women who don't have access to the top specialists, the top providers that are around this country. This country has some great providers, but a lot of times, depending on your insurance and where you live, you may not have access to a Cleveland Clinic, oncologist, or an oncologist from Georgetown because you're living in Mississippi or you're living in Tennessee. So virtual medicine really provides an opportunity to bring those specialists right into the home and provide care to the people of this country that really do need it. Thank you.
Wow. That's a
Wow.
really powerful why. It truly is. I remember my grandmother going through breast cancer treatment not once but twice, and she had a lot of pain and large incisions and lots of questions, and she would have benefited, I think, from being able to access care in the home and being able to talk to experts and get those questions answered. So we're gonna circle back to that because I want to know in how the model works, and we want to really explain to people what do they get out of it and what the benefit is. But let's talk to our doctor and our founder. Hello.
Hey, how are you guys? Thank you for having us on. I appreciate it. This is a great moment. We, we started CareClicks was really something that I kind of thought about very, very early on. When I had my first son, the doctor, you think you can manage and see different things and you know what to do, but I thought to myself, what if he gets sick at night? What's my option? And I thought to myself, well, the only option I really have is to get on a phone with my pediatrician and kind of talk to the pediatrician, but verbally I can only say so much. If I could see if I could see the pediatrician can see my child, I feel a lot more comfortable. And that kind of prompted me to say, well, why aren't we seeing our doctors remotely? And I was doing, as a radiologist, I was seeing patients remotely, a little different for me because I'm seeing images, but nevertheless, the technology was there to facilitate these sorts of things. So that's when I really embarked upon, creating CareClicks and creating a solution that would enable all different types of doctors to see patients, irregardless of where they are, because at the end of the day, as obviously mentioned, we've got great doctors, great medical providers across the country, but not everybody has access to the same quality of care. And so there was really no reason for that because there's technology to facilitate this. So it's just a matter of developing it and then implementing it and kind of getting it out to individuals and people to do so. And so we started CareClicks, it was about 10 years ago. And now we operate obviously across the US and all 50 states, but we also operate in about 30 countries, providing different types of medical care through our medical group to these individuals that are there. And we do this in different languages. And like I said, we've got a technology in place as well as a provider group to facilitate a lot of this. That's kind of how everything kind of came together up to where we are now.
So how does it work? So break it down for our audience. How does it work? What do you have to do from A to Z?
Right. So we've got recognizing people have different avenues into technology because not everybody's tech savvy. What we did was, you can do the most easiest entry point, which is your phone. You can always dial in and get to our staff and then be routed to a medical provider who can help manage your conditions. But then you can also obviously go online. You can use the mobile application, you can use the web application, basically go in, create a profile for yourself, and then be able to make an appointment with a doctor, see that doctor online, through your tablet, through your phone, through your computer, or simply just on the phone if you wanted to, and then get care. And we've been doing this now, like I said, for about 10 years. And most of the work we've done, or actually I said all the work we've done has been on a B2B type setting. So most of our work has been with the corporations, Fortune 50, Fortune 500 corporations, benefits organizations, payer groups, insurance companies, these sorts of entities. And now over the last few months, we've put together a consumer facing product, which we call My Guardian Doc. So CareClicks is the, parent, if you will, and is the harbor of the technology and the medical group. And then now we started this new product called My Guardian Doc, which is a consumer facing part of our program, which allows anybody to be able to go in and say, okay, I want to have access to the same type of care.
So CareClicks is not for patients, it's for, who's it for?
CareClicks is a product that we sell. Like I said, we've been selling it primarily to corporations and corporate entities. Patients access it, patients use it, but it's through their benefits plan, right?
Okay.
But like I said, we never had a consumer facing or just an individual facing portion of our product, and that's called My Guardian Doc. And that's something which we just launched to give patients, individuals, the same sort of benefits that we gave to corporations and employer groups before. We're now giving it to individuals to have the same access that we're giving to corporations before.
Okay.
And what are some of the specialties? I think people always want to know, is it any specialty or what types of services are people able to access?
Right. We've got the majority of the group is primary care. So your emergency medicine, internal medicine, family practice, pediatrics, those folks, right? That's the bulk of the group. And we operate 24/7. So you can get a primary care physician 24/7 on demand as needed for your care. And what we do with that is we kind of have two different avenues, if you will. There's your traditional sort of like online urgent care type of thing, where it's going to be, okay, the first available doctor is going to see you to help manage you. But we also have our virtual primary care piece of it, which basically allows for more continuity of care. So you can see the same provider, make that person your primary care if you wanted to, and see them long-term over weeks, months, years, if you wish, to manage your long-term issues. So if you're somebody who's got, hypertension, diabetes, any sort of long-standing condition that requires continuous care, then you can leverage our group and have those individual, or pick an individual you like and just have that as your long-term caregiver, just like you would if you were to go to someone's, office physically.
So how do you pay for it? Do you pay for each visit, or do you pay like a fee, or is it covered by your insurance? Like, how do you pay for it?
So on the individual side of it, we have, it's a subscription basically. So folks have a subscription to the program. You can go in and individually do like single encounters if you wish to, but most of the benefits come on the subscription side of it because we've got a lot of added benefits to it. Maybe I'll go into that in a second. But basically you can go in and you can pay out of pocket. We do work with certain insurance companies. So if we're in network with your insurance, then we can take your insurance and we can obviously specific claims and so forth and do a traditional model. But a lot of the services are out-of-pocket services. Give an example, some of the work that we do on the specialist side. So I talked about our primary care group, but we also have a specialty network. And most of the specialists provide second opinions type services. So we've got experts from different institutions across the country. And those folks are available if you want to get a second opinion from like an expert from whatever institution they may be in.
Okay. All right. So
let me jump in. Yep, and ask the question that I put in the chat. So
Yeah.
so there is a model of primary care that from the physician side of things is becoming increasingly attractive, called direct primary care.
Right.
Where we have a patient panel, let's say 50 patients, 100 patients, whatever your practice can accommodate, and those patients pay a fee for their services. And they get sort of 360 wraparound primary care services, labs, et cetera, a certain number of visits. And it's almost like a concierge model. Right. Where you can access that physician and do so in a time that works for you within the confines of the package that you purchase. It can be reimbursable by insurance, but many people end up paying out of pocket and then back billing their insurance. And I think there's great success with getting that reimbursed. But it's becoming popular for docs because they can practice the medicine they want their way. And it's right. It takes away some of the big business of hospital-based medicine, especially for primary care. So that's really interesting.
Yeah, and another thing that we've layered into it, which we found kind of unique, because we really didn't see this out there with other groups too, but it has come up for us a number of times, which is sort of medical guidance. So we've got a whole piece behind medical guidance in it, where if you do have a provider, you've got a doctor, you've been seeing them, you've got whatever issue, but as you know, I mean, sometimes treatment plans are confined by the insurance company, right? Or restrictions based on your location. I mean, there's different things that come up, right? And so those individuals or those patients don't know sometimes that there are other options, right? There's other treatment options, or there's other things that could be done. And just, if for nothing more than just reassurance that, hey, your course of action seems 100% appropriate, versus, hey, there are other choices you have too. If you wanted to wish to explore those, we'll give that sort of medical guidance to individuals as well. So that's another piece that we've kind of layered in, which we found a lot of folks that are part of our programs now like, because there's, unfortunately, now when you go to the doctor's office, your doctor, I mean, you're kind of seeing patients fast and you're going through stuff. You gotta get through a certain amount of people during a certain period of time. For us, it's like, okay, let us help reassure you and or give you some guidance into what you're doing and what's happening to you, because for a lot of folks, it's just our reassurance just helps, right? And you calm down, temperature goes down, and you feel a lot more comfortable saying, hey, okay, I feel good, I'm on the right course.
I love that you said that, because especially in oncology, getting that second opinion and hearing something again can really help to solidify it, because the first time all you hear is want cancer. And then when you get a chance to go and dissect it, exactly, Ricky, you go to another doctor and they say some of the same things and some of the same words and some of the same plan, it makes you feel, one, comfortable with the first doctor you saw that might be closer to your house, that might be able to provide care, closer to where you live. But it also helps to just reinforce, what the plan is, what the diagnosis is. Hearing it again, you can take an advocate with you. So that sort of second opinion consult is something that I think many breast cancer patients would love, because sometimes you got to travel really far to get to that next opinion.
Right, exactly. That's kind of our thought behind a lot of it has just been that, you know, I think obviously mentioned this. I mean, there's tons of places, there's tons of great doctors across the United States of America, and there's tons of places that don't have access, or it's too far to travel. You got to take time off for work, travel, stay in a hotel, et cetera, et cetera. And a lot of this can be done remotely. There's absolutely no reason why you can't have medical records reviewed, imaging reviewed, laboratory reviewed, you know, all these sorts of things be reviewed by somebody who's a, you know, an expert, who may be across the country, just to give you that sort of validation and comfort that say, hey, you know, you're in good hands. Treatment course sounds good. You know, keep going with it. Your doctors are all doing the right job, you know, that sort of thing.
And I would say our tagline is compassionate medical guidance. And so not making the patient feel like they're a number. And sometimes doctors are just so busy, right? They're trying to get through the patients, trying to make sure, you know, 75% of the primary care doctors are owned by, you know, private equity or IDAs. So they have certain metrics they need to hit each and every day. And so sometimes those patients just need a compassionate medical guidance for them to be reassured that, yes, my doctor is telling me this the right thing. Or like in Ricky's case, provide an opportunity that there is another clinical trial that's going on. Try this drug, even though it may not be part of your formulary, Aetna may not cover this particular cancer drug, but United does.
Right.
So providing an opportunity for that patient to ask questions. Because a lot of times we just don't know what questions to ask, right? When you go to the doctor, we don't know what questions to ask. I have a good friend named Larry Lewis. He's a builder. He builds houses. And if somebody were to come to my house and say, I want to build you a house, I wouldn't know what kind of studs to use, what kind of wood to use. These guys just build a house and they'll fall down next month because I don't know what questions to ask. So we provide an opportunity to kind of empower the patient with questions to ask so they can feel comfortable as they go through this medical journey fighting cancer or whatever other illness they may have.
So let me ask you this, because that brings up a really good point. Is there insurance navigation and navigation of treatment in that way, or do they just connect you to other clinicians? So for example, if a patient asks me about a surgical technology that I didn't offer, I might not know where else it was offered, but is there a service through your app that is able to say, hey, listen, you can get that drug cheaper through such and such, like that sort of navigational component is part of it too?
I mean, that's one of the goals. That's not there right now, but 100%. I mean, I think, again, from a vision perspective, as you know, just navigating the healthcare environment is hard. It's not easy. Like I said, even as a doctor, you get into it and it's like, okay, who's next? Where do I go? What do I do? And am I seeing the right person? Not seeing the right person? You can, and like I said, we've always thought organizationally, for just the average person who something happens to them, unfortunately, they don't even know where to start the healthcare navigation, right? Where does that journey start? And so, like I said, part of the value proposition here and what we want to accomplish is to help folks, if nothing else, like I said, be able to hold their hands and help them through that journey, and just say, hey, this story starts, let's say, with a primary care doctor or with a dermatologist, or you should be seeing an oncologist, or whatever the case may be. Because again, as you know, a lot of people jump from one doctor to another doctor because they just don't know. And they just of course say, they get referrals, go see this person, get another referral, go to see this person. And nobody knows, because the communication in our healthcare system just isn't there, that nobody knows what's happening except what the patient tells you, which is oftentimes half the story. And there's no one helping navigate this whole piece. And so, yes, I mean, the short answer is it's part of our program. Hopefully, it's one thing we want to layer in, but not yet.
One of the things that we have too often is somebody will come to us and will have gone to their GP, had a lump identified, gone to get the mammogram. So now they're seeing a radiologist, and then the radiologist diagnoses them and says, okay, well, I think you need a biopsy. And they're like, okay, well, who does that?
Right.
Like, where do you go? Right. And they have to figure out. So they call us and say, well, what kind of doctor do I go to? The radiologist doesn't do biopsies. I mean, like, that's how crazy it is. And then they go to we send them to a surgeon. Well, then the surgeon says, well, you really need an oncologist.
Right.
Well, what's that? I mean,
right.
I really believe, the level of health illiteracy in our community is breeding health inequity. And people just don't know what to do and don't know where to turn. And then we also get people who are dismissed. They go, especially our young women, they'll go to a doctor, present with a lump, and be told, oh, your cyst come back in 6 months. And we say, do not do that. get another doctor. Well, how do I do that? How do I find another doctor? So all of these things are this is a great resource for all of these things, because you don't know where to go. You don't know where to turn. And I love the fact that it's right here. Like everything is right here. I mean, young people, this is where they live. This is the household computer for many single moms, right?
Very true.
Yep.
And Ricky, it brings up the show we did last week or the week before on diabetes, right?
Yeah.
We did one on PCOS and metabolic syndrome and diabetes, and it brought up an entire conversation surrounding our oncologists checking certain labs, right? Are they checking A1Cs? Are they doing certain panels? Are we looking at vitamin levels, other things that might be of interest to the patient, of interest to the endocrinologist, connected somehow to how that patient might do during their chemotherapy and their overall wellness, but not things that are on the radar of the oncologist, right? And so having a safety net like this is interesting, because you can then go to that doctor and say, I've been worried about, I've got diabetes in my family. I know I have cancer, but I need XYZ, or I'm wondering how can we monitor for these things, and have somebody who's tracking that for you. And it's a convenient appointment as opposed to another building, another parking, another day off, another, et cetera. And so I think of it as a supplement in that regard. Also, my question for you is about the integration of those things. So let's say someone has an issue and they need some lab work done. Where does that happen, and how does that get integrated into their EMR and other places? Like how do they integrate their chart with their other doctors?
Right. So, when I conceptually talk about what we have here, I oftentimes refer to it as a virtual clinic or virtual hospital, right? Got this, imagine essentially a virtual hospital with different doctors, but then all the ancillaries are built into it. So laboratory, imaging, pharmacy, these things are all built into it, where these referrals can go out and then results come back in, right? So it's the same thing. So what happens is when the patient, starts a visit or wants to do a visit with somebody, we've got a care team that manages those visits to make sure they actually are seeing the right doctor, right? If it's not going to be a primary care, make sure it's seeing the right doctor. If they do see a primary care, it'll just be like a traditional primary care visit where the doctor sees a patient, takes a traditional intake and goes through those things. And now if they need to do anything with them, an example, let's order a hemoglobin A1C for you and see what that looks like, right? So that prescription will go to the patient. Now, what we've done is we've got some really good partnerships with companies that are out there in the US that oftentimes people don't know about, but we've got a partner group that they actually will come to somebody's home and draw the blood and do all the work. So from that perspective, we put the order in. This order goes, patient gets the order in their portal, right? But it also goes to the laboratory company. Laboratory company sees that we want to order hemoglobin A1C. They'll ship the kit to the patient. They'll schedule an appointment. They'll come to the patient's home. They'll draw the blood, put in the kit, goes to the lab. Results come back. Results come back just same way you do traditionally. It'll come back to our group, and then our staff will set up an appointment for the patient to review the results with the doctor. So we're trying. Our goal really is, again, organizationally, we're changing a model of healthcare delivery a little bit to make it more of a patient-centric model versus our typical sort of hospital-centric model, right? So whatever can be done, my personal feeling is I think the majority of healthcare can be done on an outpatient basis, and for that matter, can be done from where the patient is, not forcing the patient to go somewhere to get work done to them, minus intervention, right? If you have to have intervention done, you've got to go somewhere to some facility. But all the other things can be done more or less from where the patient is, and that's what our goal is, right? To improve access to care, right? Reduce the barriers to getting access to quality care, and all these different components to it, whether it's the encounter itself and or the ancillaries, bring those to the patient, right?
Okay. Yeah, I agree. And let's pivot and talk a little bit about COVID, because I think prior to 2020, 2019, telehealth was It was conceptual. It was for a few, concierge privileged people who, were able to utilize it. It was experimental. It was something that the doctors sort of were like, another EMR, another set of clips. Now we have to be on video. How does this all? I remember my practice in particular. They were kicking and screaming when they told us that we had to see patients remotely through a telehealth platform. Let's talk about how COVID impacted just the landscape, I guess, and maybe if you have any data or any stories about, the perception among the public as well.
Yeah, I mean, well, from our perspective, this should be been done, with COVID as well, right? I mean, we've been very, bullish on on telehealth as a whole. And like I said, from my personal philosophy has always been that the technologies that are facilitate all this, there's no reason why we're not doing it, right? And I think some of the barriers, doctors are, and I'm a doctor, you're a doctor, you know how it is. We're always resistant to change, right? It's the way you were trained is what you're used to. You're not going to change what you did back when you went through your training and so forth. So it's very hard to change. So there was a that sort of lift, right? And then from the patient side, what we experienced before COVID was and weren't as resistant to doing it. It was more the doctors that didn't want to do it, or payers that didn't want to pay for it or acknowledge it, those sorts of things. Overall telehealth in the self-insured world, outside commercial payers in the self-insured world had good traction. People were doing it in the self-insured world as a benefit for employees, again, with large corporations who were self-insured. It was a benefit that was available for a lot of these folks, but traditional commercial insurance payers, weren't really acknowledging it as much. Post-COVID, that kind of changed. Right now, you've got Medicare, Medicaid, commercial payers, and so forth, not really kind of, reimbursing for this. And because of COVID, it kind of prompted a lot of providers to say, okay, I've got to kind of implement this or bring this into my practice, right? I still think we have a ways to go because I still think that the programs that are out there aren't really, aren't the throughput piece of it isn't there. People are still doing it a lot of as like kind of one-offs, right? The Zoom encounters, those sorts of things, which aren't really easy to use if you want to kind of do, be successful, have good throughput, and have it done so that it works for the doctor's practices. And that's kind of what we try to do, right? So organizationally, again, from our, from the CareClick side of the world, the programs that we try to implement, what our goals really are is, yes, you want to give a conduit to facilitate the interaction, but you also want to make it so it's easy for the doctors to use to be able to see the number of patients they need to see to make this successful. And so we work with different providers on that front to make it easy for them to be able to implement these programs, use it, and make it successful for them. So it is something that's it's part of our wheelhouse. And I think actually, I would say that we are probably one of the front runners in terms of allowing people or doctors for that matter to take advantage of this technology and make it work for their patients, as opposed to like these one-off encounters through Zoom or FaceTime or whatever people have been doing just because COVID made them do it.
Gosh, we have to figure out how to make this work for people,
Yeah, I mean, I think that there is a learning curve overall, right? People are comfortable. First of all, it's your health, right? So you got to be comfortable where you're going to go. People know their local providers, local hospitals and stuff, so they trust those perhaps more than others. And again, it's and I tell all of our folks that, listen, when people are sick, they're at their most vulnerable, and they need to have things that are very, very easy to do. It's got to be easy to be able to get on and see a doctor or talk to somebody and get through your care. So we try every day. We work towards how do you make this easier and easier and easier, because it's got to just be like a click of a button, get me somebody because I'm sick and I don't want to deal with figuring out how to do all this stuff, right? And like I said, on the flip side of it, it's okay. Now I saw somebody, and like you guys said, it's like you hear all this stuff and it's like, oh my God, I heard cancer. I don't hear anything else after that, right? And how do you help people manage that and navigate it? And that's kind of, like I said, what a lot of our goals are around those sorts of things.
Well, also, I'm sorry, go ahead.
Yeah, I was going to say also, post-COVID, the technology and the solutions out there to really monitor people, it's truly amazing what's coming down the pike to be able to provide, and especially seniors, access to care, to be able to monitor the blood pressure remotely, be able to monitor the blood sugar remotely, be able to monitor, blood oxygen levels. All that technology and the AI has kind of been an accelerant, especially when Dr. K mentioned the payers of Medicare being able to reimburse for people to be able to monitor these solutions. And right now, with pre-COVID or post-COVID, we realized that the hospitals just don't have the bandwidth to care for everybody. You can't stay in the hospital for 5 days. You got to get care and get out. But the hospitals don't want people coming back because there's a Medicare clawback. So if that person comes back into the hospital within so many days, the Medicare is like, give me some of that money back. And so technology is really, post-COVID is really providing an opportunity, the virtual medicine, to be able to monitor people and really at the end of the day, keep people out of the hospital. So if the person's blood pressure is high too many days in a row, a nurse is able to reach out to the remote patient monitor and say, what's going on? Are you still eating pizza? You're not supposed to be eating pizza. You're taking too much salt. What's going on? Because if your blood pressure stays like this, you're gonna have a stroke or heart attack. You need to get back into the hospital. So it really is, technology post-COVID has really provided an opportunity to increase the touches that providers are able to have on their patients and really provide an opportunity for people to heal at home. Because most people don't want to be in the hospital. You want to be in the house. The hospital, you get sick, it's germy. If I can be at home, give me a couple of devices, I can talk to the doctor once a day virtually. It provides an opportunity for, at the end of the day, for people to live longer and have a more, better life.
I know, I think about in the breast cancer lane, how many ways how this could be helpful. And first of all, with diagnosis, if you need a second opinion, because we should all get them, right? I think that's the first area, just, where we could have help, but also nobody wants to be in the hospital. Nobody wants to. So if I can do something in my house, I have 3 kids, I'm a single mom, or I'm the breadwinner for my family, whatever. If I could do this efficiently under my control, how awesome would that be? I think about our metastatic breasties who definitely don't want to be in the hospital. They don't want to go there where they sit all day and nobody's really paying attention to them. And then the doctor does come and see them for 5 minutes, right? When you can be in the comfort of your home and have people you love around you and still see a doctor for 5 minutes or maybe longer, right? Because you're in your home. So there's so many ways this can be, helpful to our audience that we have to figure out how to do it better. Also, you could talk to more doctors. And frankly, what do people do when they get sick, especially if they have something they don't know what it is? They go to Dr. Google. I did it.
Exactly right.
We go to Dr. Google, and Dr. Google does not have the answer. He is not where you should be going, right?
Sure.
So if you could go to a source on your phone that's reliable, where you're going to find the right answer, hello, that's a much better place to go and have access to it. Because you're going to pick up the phone anyway and say, whatever, triple negative breast cancer, which I did, and it says you're going to die tomorrow. That's what I got when I went to Dr. Google 11 years ago, right?
You're 100% right. And that's what we're bringing with My Guardian Doc, is providing that compassionate medical guidance. Just think, one of the most powerful Black women in this country, Serena Williams, almost died.
Right, almost died from childbirth.
From childbirth. She almost died because of childbirth. The doctors didn't listen to her. She was trying to tell them exactly what's going on, but they didn't listen to her. And if it wasn't for Serena, she probably would have died, most likely. Yeah. And so what we try to bring in with My Guardian Doc is an opportunity to provide an opportunity where that patient can be empowered by talking to another licensed doctor to say, my doctor that I'm talking to is saying this. Would you please check this out? And a lot of times when doctors hear another doctor, they're more apt to listen or maybe do another test or do something else that they might not have done, because most people don't have a voice, especially if you're BTGQ, if you're a minority, Black, you just don't have that voice, or you don't have the confidence to stand up against a medical doctor. Right. And to question what they may say. So we want to just be able to provide that guidance instead of Google says this or Google says that. And like you said, sometimes Google may not be able to give you the right answer. And by speaking to another person, you feel more confident, empowered with maybe asking a question with your medical provider.
Yeah.
I've got a question. How do you vet your providers to make sure that they are providing compassionate care and address issues like bias? What makes this consult different than any other consult with another provider?
Yeah, we have a patient care and equity council that we're building around, and with that patient care and equity council, it's a council that's going to be able to provide an opportunity to affect all the different, issues that affect people when they go to the doctor, right? Just because you may be a transgender, you don't know if this provider has an issue with transgender individuals. And so we're going to have a training with our providers to make sure that they're have compassionate care with our care equity council. And that's something we're going to have a group of medical leaders that will be able to provide just certain things you should say and not say to certain groups of people that may be offensive, and be able to provide that care to those patients.
Mm.
Yeah, I mean, we put some effort, as you mentioned, towards the care equity piece to make sure that our medical group is cognizant of these things, and then we have a few doctors and stuff that are part of that we're growing. It's ever evolving process to kind of bring that level of acknowledgement to the medical group and make sure that we're doing that as we do our encounters with our patients.
Awesome. I think that's really an important feature because the training and support in health equity and particularly surrounding implicit bias in health systems is kind of spotty. And some systems are in favor of it and they're championing it, and others are not as much, and perhaps in some of the places where they need it the most. And so that you have or are putting a process in place to be able to do that, I think is really important for people who might use the service, who felt blown off by their first doctor, or who felt like they weren't really seen or they weren't really listened to, but to be able to come and get an opinion that feels a little bit close to what they were hoping to have in that experience that's a powerful thing.
Right.
Yeah, and we really try to focus on the because at the end of the day, your doctor works for who's paying them, right? And in most cases, the doctor is the insurance companies and the payers. And so we try to provide an opportunity to provide an unbiased type of medical guidance to that patient when they have an issue or problem.
I love this for clinical trials, Mo. Clinical trials is my lane, just because we need to get more Black people in clinical trials. We need more Black bodies in research. And so I think that, right now we are not doing a good job of it. Nobody is. And a lot of it is access and being able to go to the right, 80% of people are going to community hospitals where there are no trials. Doctors aren't inviting patients to trials, but if we could use this as a channel to get more people into research, how cool would that be? Just to be able to do it at your house, maybe you go have a couple live visits, but then you have all your maintenance care in your house, chespecially if it's like a chemo pill or something, and just do all your checks.
100%. I agree with you 100%. I think that's where that whole access to care thing come in place, and clinical trials definitely fall into that, because traditionally you've got few, whatever centers are doing the trials, but then if you're not close to it, how would you ever get access to it? It's out there.
Right.
And, you go once or twice, but how often can you actually do it? And it doesn't work out. But there's no reason, again, as long as there's no physical intervention, there's no reason why you can't leverage technology like this to be able to do these sorts of things.
Yeah, no, I think that has some very real implications, because the other issue is sort of navigation into trials. It's navigating eligibility. It's figured out all the criteria and getting all the blood work and all the imaging and all the things to even get into that trial, and then the ongoing surveillance. And the easier you can make all of that process for patients, the better off everybody will be. So I absolutely love that. I think the possibilities for this are really, really quite limitless, Ricky, with respect to not only clinical trials, but with respect to just second opinions, with respect to better primary care, right? To better optimize people for both for trials and while they're on trials, while they're in treatment, because you feel sick and lousy and miserable, and you don't want to necessarily have to get up and go see your primary doctor or get up and go to that urgent care, but you might be able to get something, at home that helps support you so you can stay at home.
Or
'Cause
you are immune compromised from the chemo, so you
That
don't want to
too.
go in the funky doctor's office. I mean, I got C. diff on my first chemo.
Yeah, yeah.
Not fun. I didn't know what
That
that
was
was.
really real.
I've always been in the hospital, so
So
those.
is this really affordable for
Yeah.
people? How can we make it more affordable? What are the access issues, I guess? Because if you're saying that you're providing greater access, I would think that some of that has to do with also making it accessible from a financial standpoint as well. So where are the areas that we want to improve that, and what are we looking at to do that?
Josie, you want to talk about some of the economics behind it?
Yeah, so for my guardian doc, you're not going to believe this, Dr. Gary and Ricky, you're not going to believe it, but it's just $39 to get started. And person, they pay $27 a month, and through the numbers of scale, we're able to provide individuals access to these providers for these medical guidance. So it's just $39 and then $27 a month, and that covers everybody in the house. And one of the things when you're talking, Ricky, I was thinking
Covers
about
everybody in the house for what?
$27 a month.
I know, for what do you get for that? That's
But
crazy.
you get primary urgent care, so you have access to our primary care network for cough, cold, runny nose, things that nature. We have access to the doctor. Then also you provide you opportunity to have access to a medical guidance as well. If you have an issue or problem, you want to speak with a doctor, you provide access to that. And if you wanted a second opinion, I think it's $295 for a detailed second opinion with one of our providers, one of our specialists. But that's some of the things that will be included. Also, we have the opportunity, we'll be able to provide the medical bill negotiation. So if the hospital is charging you $200 for an aspirin, we'll be able to send that into our medical bill negotiation, and they'll be able to talk to the hospital to maybe get the aspirin down to $80 instead of $200. And then it's supposed to be a joke.
I'm doing it right now. I'm doing it right now. I'm signing up right now.
And then also, like Dr. K mentioned, we have the ability to we partner with a lab company where if you're not feeling well, we can send a phlebotomist by your house, get your blood drawn, and have our doctors have the opportunity to kind of review your blood work. But also, you mentioned about the individuals who are fighting cancer, right? So let's say your mom, you're not feeling well, you just had your chemo treatment, but your son or daughter's sick. You don't feel like going up to the urgent care center. You don't feel like going to the emergency room. So then this provides an opportunity where now you can get a Z-Pak for your daughter, or you can get some amoxicillin for your son who has an ear infection without you having to get in your car, drive across town, and go into an urgent care center that's just full of germs and everything else while you're fighting cancer. So there's multiple ways that virtual medicine can provide an opportunity to make your life more convenient and have access to care. And then especially if you're not driving, if you don't have a car and your child's sick, you have to get on the bus. There's just a lot of different variables here that bring in that access to care directly to the home that we're able to provide with virtual medicine.
Now those prices sound right, and those services sound, just being honest, like you know, like I know, specialty copays, primary care copays, urgent care, all that stuff adds up. And being able to access those services for a reasonable fee and have closer to immediate access than waiting 3 hours in an ER or urgent care, that's priceless to a patient who doesn't feel well. So really interesting, I think, to consider this. And what's your hope in terms of the best way that communities can use this? Is this going to replace a hospital model, or is this something to supplement? Like, how does this all work together in the big scheme of things?
No, I mean, I think this is overall, it's all supportive, right? So it's basically, as obviously mentioned earlier, I mean, and we all know during COVID, hospitals were inundated with individuals who were sick, and we couldn't support a lot of this, right? But the reality is a lot of this can be managed on an outpatient virtual type of basis. So the more and more we shift people, I give you an example. I always tell people, I was like, 30, 40, 50 years ago, most of healthcare happened in hospitals, right? And then through the 70s and 80s and 90s, and currently we transition a lot of inpatient stuff to outpatient stuff, right? And the reason was for convenience, ease of use, et cetera, cost, and those sorts of things. Now we have an evolution in healthcare through what we now have, this virtual environment to provide healthcare. So now it's sort of this trajectory where healthcare will probably start in this sort of online virtual type setting. If need be, you can go to an outpatient / inpatient type setting, and then kind of, if you have to be an inpatient, you end up being an inpatient. But most of what starts in healthcare, except for like traumatic type things, right, outside of trauma, most of this kind of starts in this sort of interaction where you have an issue, you talk to a doctor, they order tests for you, and then the story starts, right? And then the journey starts. And that's where, we feel like this is a great place for individuals to kind of start that healthcare journey, and then get them set up in the right direction to go and get the right care they need at the right time, the right place, and so forth. And so that's kind of the way we look at it. We're not going to replace hospitals, because hospitals have to exist, but we think there's easier ways to get people healthcare, and this is kind of one of those things. Because a lot of times, there's patients who go to the doctor's office if they just have a cough, but there's people who wait till they're coughing out their lungs before they show up to the hospital, and then it's like it's too late. It's because they just didn't want to go, right?
Right.
So that early intervention, early action, the ease of just getting access to care, I think will help a lot of people's lives, and that's kind of one of our goals.
So these
Go ahead, Ricky.
these doctors are online, but they're also have offices. So if you wanted to go live, you could still go.
Right. If
Right.
one of the doctors is close to you geographically, absolutely. There's nothing that
Okay.
prevents you from doing that.
So you could choose, but in the moment you could.
Right.
I'm in here now. I signed up. Okay. I'd signed up already. So I just went into my account here. So I'm trying to find a primary care doctor in Maryland. Right.
So how would it work in terms of integration of other labs, imaging, things like that? Can patients connect that to your digital platform, or do your office notes and labs get uploaded into another health systems, depending on where that patient sort of gets their care?
Yeah. So from our side, all the information, all the doctor's notes, all these sorts of things are within the patient's portal. So if they wanted to take that with them somewhere, they could. If we're working with an organization, we can obviously send data electronically over, but all in all, it's there. So the patient wants to take it somewhere with them, they can. On the flip side, if the patient's seen multiple providers and has gone through sort of the healthcare journey, they can upload all that information. They can upload their obviously the documents are easy, but then also imaging can be uploaded, laboratories can be uploaded, all these sorts of things are there. And then we work also with SureScripts. So via SureScripts, we can get a lot of pharmacy information as well. So we try to aggregate as much healthcare information we can about the patients to help with the whole program.
That's great, because when you try to do a clinical trial, a lot of the issues starting out is just getting your medical records sent to the trial place. And
Right.
I've done that with some really smart, educated breasties. And it's a nightmare.
Right. Yeah, I'll give you an example. Like some of our imaging stuff, we've made it so it's pretty easy. If you have a disc as an example, which you typically get like a little disc,
Yeah.
just plug that disc in, and our software will pick up those images and have it available in the cloud, so that if another doctor wants to look at it, or if you're going to see a doctor and you want them to look at it, it's just right there under your profile. You can
Right.
look at it.
That's great, because that's definitely a stumbling block for
Right.
people applying for treatment.
You can even show the patient those images or results in real time as we're talking. I can pull this information up for you to see, so we can all be on the same page in terms of what's going on and what we want to do.
Mhm. We have a question from our Facebook group, our chat. And the question is, are there any stipulations for joining the program? Can you have this program and another form of medical insurance and or primary care as well?
Yeah, I mean, right now it's kind of like parallel or ancillary type of program where it supports or goes along. If you have an existing health plan, this can run parallel to that if you wanted to.
Mhm.
And is there anybody for whom maybe this isn't appropriate? Like, how would you source out who maybe shouldn't be a part of this? Is there anything like that, exclusion criteria?
Not that I can think of, only because I think there's enough there that
Yeah.
if it's nothing else, that hey, once or twice a year I get a sinus infection, I want to get somebody just to talk to me, fine, But and if you're like I say, if you're a person who needs continuous care for whatever long-term issue you may have, then obviously this is a lot easier than doing something else. I think all in all, my thought would be no.
Yeah, and I would say nobody knows when they're going to engage the healthcare system. Like I'm supposed to go home, but nobody knows when they're
Yeah.
going to be in the hospital. We don't actually make an appointment to go to the hospital. It's like, guess
Right.
what? I'm in the hospital. And then that's when the madness starts, the questions start, and wanting to know what's next. Is this the right thing? Is this doctor really telling me the right thing? Or is there something else I can do? And so I think everyone needs to have some type of compassionate medical guidance, because nobody knows when or where they're going to engage this, the healthcare system.
As soon as you get in the hospital, you're trying to get out. Right, think about that. Like, what are you gonna do to fix me to get me out of here, right? And frankly, the hospitals want you out too. I don't know that there's,
Well, they want you to pay, then they want you out.
right.
Yeah, well, they want to keep you out. There's so many programs and incentives now to keep patients out of the hospitals,
Mhm.
right? Like there's money going to primary care offices and incentives to really try to keep your patients out of the hospital and out of the ER. And it's becoming a quality metric if your patient bounces back and ends up in the ER, ends up getting admitted for something or readmitted. So it's so interesting how, we used to think that the money was from getting patients into the hospital, and now it seems like the money is in keeping them out of the hospital. So the pendulum is definitely swinging.
Right. And
I
this,
know they get sent home, people get sent home from mastectomies in the same day. It's
Oh
great.
yeah,
right.
yeah.
and I
The
guess,
pain control is a lot better too.
and this sort of program allows you to basically stay outside the hospital, but know that, hey, if I need somebody, they're there for me.
Right.
So how do you recruit docs to this? Because I imagine your platform is only as good as the physicians you have on the platform, right? How's that been for you, and what lessons have you learned, I guess?
Yeah, I mean, look, from a recruitment perspective, doctor recruitment perspective, a lot of doctors like to practice like this, right? I mean, it's you can work from anywhere, anytime, any place type of thing. So it works out well. So I think, we've been lucky enough that we've got some good doctors that have come on board and work with us. But it's ever evolving. I mean, I think that having people who want to do this full time, as an example, it's still not as happening as much as that as it probably should. But then I take it from the radiology world, where I would say 30 years ago, most folks didn't want to work from home as a radiologist. Okay, because you still had a mindset of going to the hospital, going to the doctors, going to the office, and
Right.
working.
But you can just get the films digitally wherever you are on a beach,
Right.
for God's sake.
100%. But I'm saying, but I'm saying the mentality was that you have to go to a hospital to work, you have to go to office to work. You didn't want to work from home because it just didn't seem right. But I think it changed. Now people
And for that reason, we are having a shortage of radiologists, particularly in breast imaging and biopsies right now, because COVID opened people's eyes to the fact that they could do this remotely and spend more time with their family and not be, chained to the hospital, so to speak. And it's impacting the downstream for us from a cancer standpoint, because the biopsies that were historically done by radiologists, we have fewer dedicated breast imagers and fewer people to do those biopsies. There's been some delays, and we're starting to see the impact of that. So that's a very interesting thing. But I mean, for quality of life, if you can do what you do and maybe even spend a little more time doing it and kind of have a little bit more flexibility in how you can talk to and treat your patients, that value proposition for a doctor is huge.
right.
So you guys, Mo is like an exceptional doctor, exceptional. She's very brilliant, and she's very humble. So she hates when I say this, but the first thing she tells the patient is, "I'm going to treat you like family." And I've watched her do it, and that's what makes her so special, because she does practice the golden rule. I'm going to treat you like I would expect to be treated. I would treat anyone in my family that I love. So Mo, would you do this?
For me, so remember when I started at Grandview, there were no other Black women physicians, breast surgeons in Pennsylvania, right? It was only 11 million people in
Right.
Pennsylvania, and there were
Now
no
you have one
Black
more,
breast-
Dr. Lowe.
There's three. There's Dr. Lola, and there's another colleague that she brought in. So now there's three of us in Pennsylvania, maybe even more out in Erie. But for like 7 years, there was just one. And I kept saying, the possibility of being able to see patients and having them hear from me, the same thing they might hear in their community and at UPMC and in great health systems. But sometimes they just want to hear from a person who relates to you, who looks like you. and know that this is for sure. I really do need this chemo. Okay, I really do need this surgery. Like that type of a consult is something that I was hoping we would have gotten to during COVID. And now these platforms are here, and not that they're emerging, but becoming a bit more accessible for us to be able to do that sort of thing. You know, imagine if Dr. Regina could see more patients. Imagine if the Dr. Lolas could be able to do this, and even more when you start talking about clinical trials, like the power of these virtual platforms. It's very powerful. You know, the only limitation I have to say, because it's the obvious one, I'm a surgeon and I can't do an exam, right? A breast exam ain't gonna happen over the computer, you know, and if you show them to me, that may be a violation of some sort. So I don't even know that can happen. But outside of that, being able to review charts and images and labs and all those sorts of things, there's a really great utility in it. So it doesn't take the place of the office visit, which is why even during COVID, I was in the office 2 days a week, you know, doing biopsies, doing ultrasounds, doing exams, because you still got to feel a tumor. You still got to, you know, you got to get the hands on. But what about after that appointment, you go see your oncologist and now you got a ton of questions? Do you really want to come back into the office and take up an exam room or sit in a conference room or a consult room? And you can do it just like this.
You know, the other area that we've done a little bit of work on, not as much as I'd like to, is in the whole collaborative piece of this, right? So you've got a breast surgeon, you got a radiation oncologist, you have medical oncologists, you have radiologists. All of a sudden you have four folks that are involved with you, and now I'm a patient, I got to go one to one, and you guys' schedules are all different. So how do we get everyone to talk at once? And this facilitates that, right? So that's another area that, like I said, we haven't done as much as I'd like to, but is an area I think has a lot of opportunity with it.
I'd like to explore that model with you, the virtual tumor board, you know, because it can
be a great thing.
It can be overwhelming for patients. I know that at Fox Chase, for example, which is, you know, in my area, they have that patient sit in that conference room and all the doctors rotate. The social, everybody comes in and out. And by about the third or fourth person, they're like, okay, you know, and it can be a little overwhelming, but in this virtual platform to sit, to go through, and just like we're doing here, it's palatable, right? You can piece together this information and you can digest it, you can record it potentially, you can get a nice little printout of all the things. I'm sure there's some kind of summary that comes from it through the medical record as well.
Right.
And, you know, we're all used to Zoom now. We're all used to this platform, right? You know,
as you know, sometimes doctors may have some contradictions to some things, right? So this helps facilitate all of this. So if the oncologist is one thing, the breast surgeon is something else, and it's a little bit different, then you guys can all talk here and the patient can hear all of it and then understand what's going on.
That's cool. What about I want a Black doctor, or I want a woman doctor, or I want a doctor that has green hair? Like, can I do anything to like search for that?
Well, so if you go online, you'll see, you know, there are different doctors of different ages and genders and races and stuff. So it depends on your location, obviously. But you can obviously see them so that you can decide if you like that person or not, as an example, and you want to see them, you could do that. But as obviously there's only a certain number of providers. So sometimes you may not have all the choices you want, but nevertheless, you can look and say, and that's what I was saying earlier. One of the nice things is that you can be consistent with. So if I do see somebody who's a doctor that I like the race and gender and yada yada, that stay with that person. I can, next time I'm sick, I can say, well, you know what? I want to make an appointment to see Dr. So-and-so because I like them from last time. That sort of stuff.
Right.
And that makes patients feel really good to be able to have that control, because you know how sometimes you go and you end up seeing a different doctor or a nurse practitioner or whomever, and you're not able to have that person that you connected with. All right, so we got a question in the chat. I might have missed this, but if it's determined that a patient does need in-person hospitalization, right? So let's say your blood work is way off, or your vitals, or you're not looking too good here, and that doctor's like, you might need to go to the hospital. Does this plan cover that at the same $27 per month cost? And if not, how is the extra cost determined?
No, all these other, so the cost is for the encounters that we're providing, right? If anything comes up after that, as an example, if you have to go to a hospital, then that would be, if you have a health insurance or whatever sort of coverage you'd have, it would be on that. We don't cover hospitals.
So the way to think about this and your cost is just like a copay for the service you're getting today online.
Right. It's just like, again, it's like if you went to your doctor's office, You see your doctor, you pay your doctor for the service your doctor did. If your doctor says, hey, you got to go to the hospital,
You gotta say you gotta pay again, right?
Right, we just
Gotta
said-
pay the hospital, right?
Yeah, right.
Well, you guys, this has been like really informative, and I think a conversation that we need to keep
Yeah.
having, you know, and get people more comfortable with it. But I'm on here now. I'm gonna try it, make my next appointment this way. And
Yeah. Yeah, let us know. Circle back with
yeah,
us
let
on
us know
how
how
it.
it's doing and how it's growing, and
Mhm.
we should, you know, write about it and think about it and talk about it some more, because we need to do it. I mean, people need to get comfortable, and I think it's a good time now because we are so used to Zoom.
Mhm.
Having weddings on Zoom, birthday parties on Zoom. We did all this during COVID, so why not go to the
Job
doctor,
interviews on Zoom.
right?
Mhm.
Job interviews, everything, right? So why not talk to your doctor and have access in your house?
We'd
And
love to come back.
if prescriptions are ordered, I got one more question here. Prescriptions, can they be sent directly to the home from the pharmacy, and or does that person have to then connect to their pharmacy and have it sent? Are there capabilities?
Yeah, so the patient has the ability to select their preferred pharmacy. One of the preferred pharmacies that we have is a mail order pharmacy. So if they wish to have the medication come to their home, then yes, they can just say, hey, I want to use Diamond Pharmacy, and that will come directly to your house.
Mhm.
Boom, there it is. So even better. I think the take home here is that telemedicine, telehealth is number one, it's here to stay. It's not a passing fancy. Two, it's increasingly sophisticated so that we can give people what they need in the setting where they are, right? We need to meet the patient where they are. And for too long, we've required patients to come to us, to these bastions of, the hallowed halls of healing, which end up being, nightmares sometimes for people who are trying to navigate a system that they don't understand when they're not feeling their greatest. So services we can provide to people at home, concierge services, expert services, specialty services, even just primary care is not even primary care is huge, right? Like that's the safety net. The safety net, most people, if you look at it, especially in the Black community, many people use urgent cares and ERs as their primary
Oh,
care.
ER is a doctor. Yeah.
Right. And so, having this type of service, assuming that the person has access to broadband and that sort of thing, this I think is a really powerful tool.
It is.
Agreed.
All right. So how do people reach you? I mean, I put the websites in the comments. Do you want to put an email address in there or anything, or they can come through me, email me, and I'll get them to you?
Yeah, I mean, they can go to info@careclicks.com or info@myguardian.com. Both of those will get them to where they need to go.
Great.
Awesome. Well, we hope it's been relatable and reliable and real, and we know it has, because this is what's happening right now, 2023, and more to come. So that's what we do every Wednesday night here on Black Doctor. We're thankful to our sponsors, to the platform, to our guests for bringing this really powerful tool. And I'm going to say it again. We got careclicks.com and we have myguardiandoc.com. These are great opportunities for you to get concierge care, primary care, maybe even specialty care in the comfort of your home at really, really reasonable rates. And so we appreciate it so much.
Thanks for the time.
Thank you so much.
Thank you.
Thank you.
Thank you
Thanks for
guys so
doing
much.
this.
You guys did good on a girls' show.
You did great. Let's see if they can make the heart. What do you think?
Yeah, you gotta do breasty love. You gotta do breasty
There
love.
it
Yeah.
is. Can you give us a heart? All
breasty
right.
love.
Here you go.
Thank you so much. Be blessed.
Take care.
Next week we have our interns coming on, I think.
Awesome.
We have
Fantastic.
14 interns.
Bye-bye.
Take care.
Bye.
Bye-bye.